Hello. So, what is microtropia? It is a small angle strabismus, usually small angle esotropia, less than 10 prism diopter. Both eyes, it is a manifest strabismus, but both eyes are looking straight and there is no central fusion but only peripheral fusion. Stereopsis is reduced. And most of the people will have anisometropic amblyopia in the affected eye. Now, when you do a cover test, you will see that there is a movement. Now, there are two varieties. One is microtropia without identity and microtropia with identity. So, in microtropia without identity, the point of fixation used by the monofixing eye is not corresponding with the fovea of the fixing eye. And because it is not corresponding with the fovea of the fixing eye, so on cover test there is a movement. Okay. Whereas in patients of microtropia with identity, there is an eccentric fixation. The point of fixation in the microtropic eye is corresponding with the fovea of the fixing eye. So there is no movement on cover test. So here you need a 4 prism diopter to confirm microtropia with identity. Microtropia will have stereopsis reduced from 3000 arc to 70 arc second is the range. And when you do the sensory fusion test with the random dot, these patients will fail. Whereas when you do with the litmus fly, they will pass. Because random dot uses bifoveal fusion, whereas litmus fly does not use bifoveal fusion. So these patients do not have a bifoveal fusion. Actually, one eye of what is monofixation? The one eye is having a suppression scotoma. So the patient is not able to fix with the eye. Though you see that the patient is seeing with both eyes straight ahead on an object, but actually he is seeing only with one eye. The other eye is having suppression scotoma. So it is called as a monofixation syndrome. Now, they are fixing with only one eye, and the point of fixation they are using in the affected eye, if it corresponds with the fovea, then there is no movement on cover test, which happens in patients of microtropia with identity. So there is only two varieties, with identity and without. In without, there is movement on cover test. In with identity, there is no movement on the cover test. So the small angle strabismus, where the peripheral fusion is there, there is no central fusion. Stereopsis is reduced, anisometropic amblyopia, and ARC is present. What is ARC? In ARC, the fovea of one point corresponds to the non-foveal point of the other eye. So ARC will also have binocular vision, but that is not very good as compared to NRC. ARC is present in a small angle strabismus, mostly microtropia. So this is all about microtropia.